Now I read the last document, what is Goal 3, Good Health, and will begin. Great strides have been made in improving people's health in recent years. 155 out 200 countries or areas have already met or are on track to meet the SDG target on under 5 mortality. Effective HIV treatment has cut global AIDS related deaths by 52% since 2010, and at least one neglected tropical disease has been eliminated in 47 countries. However, inequalities in healthcare access still persist. The COVID-19 pandemic and other ongoing crises have impeded progress towards Goal 3. Childhood vaccination have experienced the largest decline in 3 decades, and tuberculosis and malaria deaths have increased compared with pre-pandemic levels. The Sustainable Development Goals make a bold commitment to end the pandemics of AIDS, tuberculosis, malaria, and other communicable disasters by 2030. The aim is to achieve universal health coverage and provide access to safe and affordable medicines and vaccines for all. To overcome these setbacks and address long-standing healthcare shortcomings, increased investment in health systems is needed to support countries in their recovery and build resilience against future health threats. This becomes especially critical in safeguarding vulnerable population groups and individuals residing in regions burdened by high disaster prevalence. By doing so, we can strengthen health system and foster resilience in the face of health adversities. Immunization is one of the world's most successful and cost-effective health interventions. However, the alarming decline in childhood vaccination, the largest sustained decline in childhood vaccination in approximately 13 years, is leaving millions of children at risk from devastating but preventable disasters. Does everyone have access to health care? Universal health coverage UHC aims to ensure that everyone can access quality health services without facing financial hardship, while efforts to combat infection disasters like HIV, TB, and malaria led to significant expansion in service coverage between 2000 and 2050. Progress has since slowed. Inequalities continue to be fundamental changes for UHC. Coverage of reproductive matter, child and adolescent health services tends to be higher among those who access to essential health services. A significant portion of the global population still lacks access to vital healthcare services. To bridge this gap and ensure equitable healthcare provision, addressing disparities is critical. Various determinants of health, including environmental and commercial factors, need attention to pave the way for achieving our common objective for health for all and achieving the Sustainable Development Goals target. How can we achieve these targets? Ensuring healthy life for all requires a strong commitment, but the benefits outweigh the cost. Healthy people are the foundation of healthy economies. Countries worldwide are urged to take immediately and decisive actions to predict and counteract health change. are rich, more educated, and living in urban areas, especially in low-income countries. What can I do to help? You can start by promoting and protecting your own health and the health of those around you. By making well informed choices, practicing safe sex, and vaccinating your children, you can raise awareness in your community about the importance of good health, healthy lifestyles, and well as people's right to equality health care services, especially of the most vulnerable, such as women and children. You can also hold your government, local electors, and other decision makers accountable to their commitments to improve people access to health and healthcare. Thank you.